going to do a video on how to use myofascial energetic release to open the pelvis. So we'll show you some work on the back of the pelvis and the low back and the Quadratus Lumborum, which is a muscle that connects the pelvis to the lumbar spine and to the rib cage, a deep core muscle. So we'll work through this whole area right into the pelvis. Now I'm just going with superficial fascia, and I'm working slow, having 𝐾2 breathe into my touch. And I work slow and deep. And get him to open his breath right into here. Yeah. A lot of people suffer low back pain, yeah? And low back pain and the position of the pelvis and the holding that's in the pelvis are intimately connected. So as I release the low back deeply with my fingertips and thumb, I have him breathe into my touch. Yeah, and start to work right into the sacrum. The sacrum and the connection between the ilium and the sacrum at the sacroiliac joint starts right about here. You can feel the posterior superior iliac spine right here. It's a bump. Yeah, and here's the beginning of the sacroiliac joint. So I can work right on those sacroiliac ligaments like this with my fingertips specifically. Get right in the joint here and start to release these fascia and the connection between the ilium and the sacrum by opening these ligaments right at the joint. Yeah, and then I can take a back of my hand and start to work the top of the gluteus like this. Right in through the gluteus maximus. If I go a little deeper through here, I start to get to the gluteus medius. Oh. And follow any movement, just like you just were doing. It's nice. Movement comes, follow it, yeah. And now I can come here and just start to work the whole gluteal muscle that attaches the maximus and the medius, that attach right up here on the crest of the ilium and the top of the ilium, right around here. Yeah, and release all the way down and around. Good. Here's the crest of the ilium right here. Here's the top of his ilium. So I'm going to work to release a lot of the gluing of fascia that happens right at the crest or the top of the ilium. And I do that with my thumbs. I meet right in here. This is also where the Quadratus Lumborum, a very important muscle, deep muscle, attaches to the ilium right at the crest, right through here. And so I start to release it with my thumbs like this. Oh, good breath. Yeah, and he's breathing into my touch. Is that painful? 5, okay. So it's not painful. Okay. And he's starting to unwind, so I support his unwinding just by having him breathe into the movement and allow it to move through the whole body wherever it wants to go. Now I'm in between the 12th rib, which is here, and the crest of the ilium, which is here. And I go in that valley, and I go with my thumb like this, and I come in, and with the other thumb, I support the thumb that I'm touching with. So I'm working with my right thumb, and with the left thumb, I'm supporting. And then I go right into the Quadratus Lumborum like this. And I have him breathe there. And I can also ask K2 to stretch his left leg down through the pelvis and stretch. And that stretches the Quadratus Lumborum. And I keep working on it. I can also ask him to stretch this left hand up and stretch the leg down, and he gets a double stretch right through the quadratus area, and then just follow movement wherever it wants to go. Yeah, that's it. And I just stay for a while. This is a very tight muscle on almost everyone, this central core of the body. And I'm starting to feel some release in it, but it's pretty tight in here, so I give it some time, yeah? And I work it just by slowly moving my thumbs and having him stretch and move and breathe. Yeah, good. Okay. You can bring that arm to there, bring it to there. Now I'm going to work that same valley where the quadratus is, but with the forearm. So here's the crest of his ilium right here, and I get right in that valley between the 12th rib and the top of the pelvis, and I just drop weight like this and start to have him breathe. Pain's okay?
Yeah,
okay. And I give space, yeah, and have him really breathe. He's moving beautifully. So he follows the movement, and beautiful, yeah. Nice. So here is the crest of his ilium. I'm going to come right at the top of the pelvis again and do a broad stroke with the back of my hand like this. Have him breathe into his lower back, into his pelvis, and follow movement like he's doing very well. And I keep moving and sliding slowly. Yeah, good. And then I take a little lower on the pelvis, like here's the top of the pelvis right in here, and I come a little lower into the gluteal muscles and stretch it all the way over like this into the greater trochanter of the femur, which is right here. Yeah, it's right here. So I take the back of my hand and slowly bring it in with the breath and just release. Yeah. Now I'm going to do a broad forearm like this, just down through his pelvis. Here's the sacrum. Yeah, so here's the edge of the sacrum. So I'm going to come right at the edge of his sacrum and start to get the attachment of the piriformis as I go deeper, right through here, where it attaches into the sacrum. And I just work like this. Yeah. And then a broad stroke, a little more to the laterally to get the gluteus maximus and to work the gluteus maximus down like this. Yeah. Yeah, good. Have him breathe right into here. Here's a spot. Is this too much? Or so 6 is a good pain, so this is a good level, a good depth for him, and I just stay there, yeah, and give it time and have him breathe into my touch and follow movement like he's doing so well, and yeah, just verbally support him to breathe and to follow his movement or any shaking that might come up. Yeah, there's some tremor happening. and I go a little lower. I slowly slide down, so I go lower and lower, yeah, like that. Then in between, you always give space. You heard that breath, it was a large breath, to integrate and to see if there's any movement that wants to happen.